So to start off our afternoon programming, our section on research and science, I would like to welcome Dr. Melinda Kavanaugh, Dr. Andre Mochan, Sheila Slaber, and Professor Thobeka Nkomo for their presentation, Developing Young Carer Education and Support Programs in South Africa.
Hello, and thank you all for joining us as we present our project on caregivers support programs in South Africa, where we really focus on building capacity and sustainability to provide care supports for children and youth who are caregivers to a family member with ALS and MND. I am extremely proud to be a part of this team. My name is Melinda Kavanaugh. I'm a professor of social work at the University of Wisconsin-Milwaukee, and you are going to have the wonderful opportunity to meet the rest of my teammates throughout this presentation. But I didn't want to move forward without acknowledging all of the amazing universities and organizations who are so deeply involved in this program. And we wanted to situate the timeline so that you got a good sense of the fact that we've been working on this project in some capacity since 2015, when we first met to really talk about how can we understand and provide support for caregivers in South Africa. We received funding back in 2016 from the International Alliance, and then in 2019 received funding from the ALS Association to build on the interviews and information we gleaned in 2016 and 2017, which told us that there is not enough support for any caregiver, much less children and youth who are caregivers for a family member with ALS and MND. Unfortunately, like the rest of us, we ran into a huge glitch with COVID. Doing international work is very difficult during a pandemic, but we are grateful that just recently we were able to spend a couple of months really digging in deep and building on this collaborative, which is what we're going to present to you today. And what this program is it's situated in something called Y-Care, which is a youth caregiver training and support program that includes multiple modules around basic care, communication and feeding, assistive devices, and support. And the reason why this exists is that worldwide, there's not enough training and support and skill building for children and youth who are caregivers, and particularly in South Africa, no program like this exists. And we know that children and youth are deeply, deeply involved in care in South Africa, again, around the world. But taking this program, which we initially developed in the United States to be able to adapt to the South African context, is really the base of what we're presenting to you today. And there were a lot of assumptions based on the US context that we would have access to a variety of healthcare professionals, that we would have lots of durable medical equipment. But what we understood is through our previous work and working with my colleagues, which you're going to hear from in just a moment, is that do we really have access to these allied health professionals? We know that there's a lack of available durable medical equipment, and we need to make sure that we are responsive and thoughtful to understanding the role of cultural and spirituality in particularly the South African context. So we needed to focus on the community, we needed to be flexible, we needed to integrate the parents, and most importantly, we needed to create something that was, again, very cultural. And I'm going to introduce Professor Andre Mochan, who is going to talk about how we built this handbook for our families and children.
Thank you, and greetings to everyone. It's lovely to be able to present at this forum. And indeed, we had a wonderful youth care booklet that we received at the time when we were all locked down. And it had obviously an entirely American slant to it, in that it was clearly based on the situation on that side, both what the practical issues of food items and other brands are concerned, as well as the available, products for care and for caregiving and equipment materials. So really, we had a good chance to look at that and then decided to sit together. And that was a wonderful team effort of all people involved, really, that you see on that list, and it might not even be extensive, to really adapt this to the South African context. And the first thing we really had to attend to was to minimize writing and text and maximize images and pictures. So that was really a wonderful effort and teamwork to really adapt it in that way. And even the drawings on the anatomy of ALS, we clearly put into a more locally appropriate context. And it was a wonderful collaboration, really, to and fro, obviously, everything online during that period, where we really had wonderful brainstorming sessions, and then came up with a fully adapted South African version, locally branded, and everything really appropriate to the context. It was obviously still in English and not in one of our local vernacular languages, but it was with sufficiently little text to allow for good reading and a lot of looking at the wonderful pictures that we had put together. Please advance, Melinda, to the next slide. Once that booklet was then printed and put together, and once we had the team basically together in South Africa, we sat at the two sites, which were Cape Town and Johannesburg, with the relevant team members, and that was really the MND Association staff. It was then multidisciplinary team members, especially in Johannesburg. We had physiotherapy, speech therapy, we had social work obviously on board all the way, sitting together on to basically devise and plan how to implement the practical sessions. And that was another wonderful teamwork to really work out and plan together how we would set up the scenario, how we would guide the youth caregivers through the program. And from that, we really managed to have a few wonderful sessions on both sides. And with that, I'd like to hand over to Sheila, I think.
Yes, this is Sheila Slaver, who is the Vice Chair for the MND Association of South Africa. Hi, Sheila.
Okay, this was implementing the YCAM. We had 2 sessions in Cape Town, which we had a church hall that we could accommodate us. We had one in Johannesburg at Para. We had a total of 27 youth and 4 adults that participated. Professionals that were trained, we had 7 of our advocates that did the training. We had 2 physiotherapists, 4 speech and language pathologists, and 2 neurologists. It was an exciting event, and thanks to Melinda that we could have gotten this far. This was amazing. You can go to the next slide. The critical support piece that we had was the youth sharing their information, supported each other, helped answer questions throughout, and they had to cry every now and then, but there was somebody to, shoulder to when they needed it. Patients' advisors, after the second session, they felt more secure, and the understanding of who the family is and the caregiver and how best to support them. Inclusion of the pressure support or pressure sore and wound care was very important. Useful module, because that is when the patient or the therapist are not available to provide the training. Capacity building by engaging and training the patient advisors. Sustainability with patient advisors are the ones who are most of the time with the families and doing the home visits. It's easy adaptable to the organization and the patient advisors. Next slide.
So I'm going to transfer over now to Professor Tobeka Nkomo, who is going to talk to us about our translation of materials and our next steps.
Greetings to everyone, and thank you for having me. I will elaborate on 2 aspects that are related to the program, which is sustainability and collaboration. So we've heard that we had a session in Johannesburg, which is in one of the provinces in South Africa, the province named Gauteng. The province is very diverse, and which means it has got different languages, religious beliefs, and therefore we needed to make sure that in terms of context and content, we align ourselves with the environment of the patients that were going to be served. We therefore looked at the material, which was the handbook and the youth graphic novel. And these two, because Gauteng predominantly is a Zulu-speaking province, we therefore agreed to translate the manual and the novel into isiZulu. And these were translated with the collaboration of the university staff members in the Department of Social Work. We had other university translators, qualified translators who are working closely with us so that we make sure that we do not misrepresent the pictures and the language that we depict from the manual. Having done that, we ensured that whatever we do, there should be continuity and there should be sustainability. And therefore, we agreed that we'll have to continue providing training to the patient advisors and then adapt home visit. And the reason behind this was that there's an issue around transportation. Gauteng is a very big province, and therefore, if they have to transport or travel from their homes to the hospital, then it becomes costly, because we do know that it's not everybody that is in Gauteng that is well off in terms of financials. So we agreed that we'll have this collaboration with the government in South Africa, particularly health department, because they do have healthcare workers who will be able to visit homes and who really know very well the patients and their homes, including the environments. So they'll be able to address whatever needed to be attended to at a close range. And therefore, by doing so, even if we are no longer there, the project will be sustainable, because people would have taken the ownership and would have been able to implement whatever needs to be implemented in terms of the changes and suggestions. Thank you.
Thank you, Professor Nkomo. So this wraps up our presentation. We had so much to provide, and we very much look forward to any questions you might have for us. While this is a recording, we will all be here live to answer any questions you may have, which is wonderful. But before we left, we wanted to make sure that we were very clear in thank yous. Most and foremost, the families that participated in all of our projects over all of the years. Our funder for this particular project, which is the ALS Association. The ALS Wisconsin gave us some amazing supplies, some t-shirts and bags for the children and youth. And our absolutely brilliant, amazing research and development partners. You have met several of them on this call. I would be remiss if I didn't mention Professor Francois Henning, who is at Stellenbosch in Cape Town, who was also deeply involved in this project. You'll see all of these individuals, from neurology at Baragwanath Hospital to Stellenbosch Neurology, to the MND Association and the Witwatersrand School of Social Work. So we thank you all very much, and we look forward to answering any questions you might have for us. Thank you.
Yay. Hello, Professor Mochan, Professor Nkomo. Hello, hello.
Thank you for being with us. I understand that it is 1 a.m. in South Africa, so thank you very much.
They win.
For staying up. Yes, you win the award. Thank you so much.
Bravo, bravo. We are missing one person. I will say, if anybody has been kind of recognizing in the news lately, power outages are rampant throughout South Africa. And so Sheila is having a difficult time getting on. So hopefully she'll be able to join us, but yes.
So at this point, we will take questions. I'm going to ask if there are any questions that have come in online first. Not yet. All right, so we'll take questions from the room. Well, can I start with one? Oh, sorry.
There's a,
Is there-
No, yeah.
Is there a hand? I'm sorry, I couldn't see from here.
That's okay, Andrea. You go first, and then I'll go.
So really, my question, Dr. Kavanaugh, is, given all of the different cultures that are based in South Africa, how did you account for reaching out to people of different ethnicities? I know you translated some of it into Zulu, but I know there are lots of languages and cultures. And what sort of lessons did you learn from that process?
Oh, my goodness. I could probably talk for 3 hours on that. That's a solid question. First of all, a lot of the providers represent the multiple different groups in and across South Africa. So we had people who themselves identified as different regional individuals across the country. So they really helped us guide a lot of the information and a lot of the specific pictures and content throughout the manual. I would love to hear some of this feedback from either Dr. Mochan or Professor Nkomo, both of whom Dr. Mochan I've worked with him for many, many years, and Professor Nkomo also for several years. Both of them are based in Johannesburg. So I'm not sure if either one of you, I would love to bring them in to see if they wanted to answer that question or address it in either way.
Thanks, Melinda. Maybe let me just then state at this point that our clinic setup, where we are based at Baragwanath Hospital, is really it is an urban setting in the big city of Johannesburg, but it really serves a rather, let's put it, underprivileged really population of Black urban, town dwellers, sometimes quite impoverished in nature. So that is really the population that mainly our particular MND clinic serves. So that is been not exactly the target group clearly of our research, but certainly has been involved just based on the fact that this is our actual population that we are operating in. Thank you.
And I'll add one thing, and Johannesburg is very different from Cape Town. If any of you have ever been to South Africa, they have distinctly different kind of feels and different makeup of individuals. And so when we were in Cape Town, we had primarily individuals who identify themselves as a racial group of colored, and those are individuals who are either historically from a Malay or Indian community or who are of mixed race. So we had much more of those individuals in Cape Town. Their native language for the most part in that group was Afrikaans, whereas in Johannesburg, we had much more Black African community speaking Zulu. So while we are in the process of translating the materials into Zulu, we're also working on translating them into Afrikaans as well, to be respectful of at least 2 of the 11 national languages found throughout South Africa. Did I represent that all right? Fabulous partners?
Very well. Very well.
And I think Kathy also had a question.
I do have a question. This is a fantastic collaboration of many different stakeholder groups. So you have clinicians and universities, and you have MND South Africa. Mm-hmm. Was there anyone else that you wish was at the table when you were doing this project, or do you feel like you covered the whole waterfront with all the stakeholders?
That's a really good question. I mean, I think we did have a really broad coalition because we've been working together for so long. We've taken the time to reach out to different groups, to different organizations. We have, both medicine and social work represented. We have physical therapy, occupational therapy. Perhaps what would be really great, and maybe Professor Nkomo could speak to this, is that one of our next steps is to engage the government and their coalition of community health workers who go out into the homes, and they go out into some of the tougher areas for many people to go into, some of the more township areas. And so that's really our next steps, is to work with those organizations and train them. But Professor Nkomo, I'll put you on the spot to see if you wanted to address anybody else you thought we might want to include.
Thank you, Prof. Kavanaugh. I think the most significant part or the contributors in the project are the carers themselves, because we believe that even if we can come as people who are knowledgeable, but if they don't form part of the project as the key role players, then it will not be meaningful. So for us, much as we want to collaborate with government for continuity and for maybe support in terms of going forward, the families or the carers themselves are the ones that play a key role. Thank you.
Well said.
I think we have another question here in the room.
Yeah, thank you. So at the beginning of the session, Maury and Lori talked about, over here, Melinda, hi.
Oh, okay. I was like, there's a voice.
Yeah.
Yes.
Maury and Lori were talking about access to clinics.
Yes.
And they showed a slide where lots of people, including in your state, who we're not accessing clinics. In some cases, we're living fairly close to clinics. And now you have a wonderful example of culturally specific materials. And I'm wondering if you or your colleagues have thoughts about if culturally specific materials would be more effective at engaging people into services, assuming those services are available. And I don't know if if the difference would actually translate from, the Great Lakes states in the United States to what's going on in South Africa, but clearly even within the US, we have different cultures and we have access challenges and different cultures.
It's an excellent question. And I think that the key is to recognize and kind of embed yourself in like what Professor Nkomo said, and what we've all really spent all this time in South Africa doing is getting to know the community and the culture and the people who are part of it. And I think whether you're in South Africa or you're in, Lac de Flambeau, Wisconsin, there are cultural aspects that need to be integrated as to why people make choices as to do or not do something to do with healthcare or accessing services or supports. And if they see that you've taken the time to make it be culturally relevant in their language, in their, using photos that look like them, using materials that are really respectful of those individuals in that community, I think regardless of where you are, it would increase people's engagement because they feel seen, they feel heard, and they feel that they're actually a participant. That's my colleagues. I don't know if you guys want to answer.
Thank you. I think we have a question online as well.
We do. Albert Kaya would like to know what the average age is of the young caregivers.
So in South Africa, we actually had quite a few very young children who are providing care. And we don't have a national statistic, so I want to be really careful that we don't know nationally across South Africa. In our work, the average is between 8 and 10 years old. Yeah. And they are, and as our colleagues can certainly respond to, that they've seen, these are children that are transferring and lifting and bathing and toileting. And Sheila talked in the presentation about pressure sores and wound care, which in the United States we certainly talk about, but there's a lot more access to support for moving people around and care. In South Africa, another big point to your point about culture is understanding there's a lot of stigma around a disease like ALS. And so there's a lot of assumption that you are somehow cursed so that people avoid you. And so then someone living with ALS does tend to kind of stay in the same position for an extended period of time. So helping those caregivers understand that. Yes.
I'll have to make this the last question, so we stay on time.
Sorry.
Thank you.
First off, just an endorsement. You guys do awesome work. You guys launched in Texas last year, and it was overwhelmingly successful.
Yeah.
So it was very well received. My question about the cultural differences here in the United States, we don't have the multi-generational households, meaning 3 generations or 4, 3 generations living in a house. And then, but in a lot of countries like South Africa, I'm assuming there's more multi-generational households. So would you see that in those countries, there's going to be more younger caregivers? Because here in the States, we look at the caregivers, the youth caregivers we look at are, 15, 16, 17 and older. So do you see that possibly in some other countries where there's multi-generational families, there's a need for this, greater need for this than maybe here?
I would love my colleagues to answer that, but I will say in the research that I did in the ALS community on young caregivers, kids were as young as 6 providing care in the United States. So by no means is it exclusive to a teenage population. Professor Nkomo or Dr. Mochan, would either one of you like to respond to that question?
I also think, just to add, in terms of the age group in South Africa, most of the families are child-headed families. So that's why you end up finding children caring or young people caring for the adults, because some of them parents have left, some of them parents themselves are ill, and therefore they have to take care or take the responsibility of being the carers in the family, and therefore they take the lead as the carers in one way or the other. Yeah. Thank you.
Well, with that, thank you very much. This has been a lovely, very informative conversation. Thank you, Dr. Kavanaugh, Dr. Mochan, Sheila, and Professor Nkomo. Thank you very much.
Thank you. Thank you. Thank you,
Thank you.
colleagues. Thank you. Thank you all.
Wonderful.